I'd like to introduce our next speaker, which is Dr. Tausif Ahmed. Dr. Tausif Ahmed is the Medical Director and General Manager of NURA AI-enabled imaging and expert healthcare. Finished his MBBS from Alamein Medical College, Bijapur, and his MD in Accident and Emergency Medicine from Sri Ramchandra University, Chennai. He has been associated with the specialty of emergency medicine for the last 18 years. Dr. Tausif was honored with multiple awards for coordinating relief and rehabilitation efforts during the Chennai floods of December 2015. He is an instructor for advanced trauma life support and advanced cardiac life support, amongst others. And just like Dr. Amarnath shared an interesting fact about himself, that he's an active wizard, here is an interesting fact about Dr. Tausif Ahmed. He's had a stint as a radio jockey for 10 years. Dr. Tausif, the stage is all yours.
Thank you for the kind introduction. And yes, I was a radio jockey, not anymore, but I was also a practicing doctor, just in case you're wondering. Both professions went hand in hand. I was an emergency physician, frontliner during COVID, just like Dr. Amarnath. But yes, over the last 1.5 years, it's been a rewarding entry into preventive health for me. And of course, it's the same amount of time that I know Nidhi-san, as we call it. We're all Japanese, yes. So Nidhi, we know her since the last 1.5 years, Chitra also as well. And I've always been amazed when I meet the Silver Talkies crowd. It's been amazing. I've probably done about 3 or 4 sessions, talks for them. Such a vibrant crowd. I don't get that crowd anywhere else. I mean, all due respect to all the other crowds. But I know when I go for a Silver Talkies meeting and I'm delivering a health lecture, I will have questions. I know I will talk only for about 25 odd minutes, but then the question answer session will go on for 40, 45 minutes, and Nidhi-san will say, okay, we have to end now. Time's up, and we have to go. And that's how all the Silver Talkies, events happen. And I'm really happy to be here and seeing such a full crowd, because Nidhi-san was like, we're coming back after 2 years, post-COVID. I don't know how many people will come. Nidhi-san, full house. Congratulations. All right. Okay. Dr. Amarnath talked about how we can stay healthy or prevent having any mishaps that take us to the hospital, and meet him, although he's a very pleasant personality, as you noticed from the whole conversation. What I'm going to show you is how to know if you're healthy. And that is the area that NURA deals with. So let's go on without any further ado. So what makes us happy? That's what I want to start with, right? So these are some of the things that we love to do, and Silver Talkies, for the Silver Talkies Club and members, has a very integral role in this. We love to have conversations, we love to go out on walks and do things that we enjoy, interact with the world, with our family members who stay at different parts of the world, our friends who stay on different parts of the world, and of course, socialize a bit, enjoy, dance, have a fun, and the chess match. It's an assumption that as we grow older, we always play chess. Is that true? I don't know how many of you play chess. Every movie that I've ever seen, and they're seeing 2 elderly people meeting together for a cup of tea, they take out a chessboard. I don't know how true that is, okay? But I love chess. I used to play chess a lot. So yes, I'm looking forward to that when a little later. Okay, so moving on. Lifestyle is what makes us happy, our quality of life, to be precise, right? But to have a great quality of life, we have to know that age is not a barrier. As we age, we can still be happy and have a fulfilling life, right? There are many events today that are targeted at the elderly population, like we have sports events. We have record holders in the 100-meter sprint, and elderly people, 80-year-old people, 90-year-old people who are record holders, right? And of course, does happiness decline with age? Well, aging is relative. There's a very nice picture. A bird, an entire lifespan can be only 4 or 5 years. Of course, there are birds that live for 20 years also. And a turtle, 250 years. And the average adult, or human, probably about 65 years in India. Some countries longer, but in India, about 65 to 68 years. Okay, so age is relative. What you really need to have great aging is a healthy mind and a healthy body. That's very, very important. A healthy body is what makes us feel that now is the best time of the year, right? So a healthy body is very important. That equates to a healthy life. So how healthy are we today, right? From here on, let's talk about health. So what's killing India today is heart attacks. And I love that slide where Dr. Amarnath showed about screening. All the things that NURA does is there on that slide. So I'm like really happy. Yay! I want to just pause and say, stop,
We never met before this.
First time, right? And I was actually, thinking, oh, Dr. Amarnath, geriatric medicine, I'm going to see somebody with a tie and a suit and everybody. And I'm like scanning the room, right? And then I see this very sharply dressed young person sitting there, curly hair. I'm like, okay, that's the doctor? All right, okay. Right, so there you go. Anyway, so this is what is killing, sorry. Very kind of you, ma'am. Thank you so much. Very kind of you. All right, so what is killing India? We're looking at heart attacks, lung disease, and cancers. Cancers are no longer a disease of the West. It is coming to India. The incidence may be less, but the fatality is much higher because unfortunately, 80% of India's cancers are detected only in stage 3 and 4. Only 20% is detected in stage 1 and 2. And our movies don't help. Like I always tell everyone that I talk to, in a movie, if they want to kill somebody, they say, oh, cancer aa gaya. It's got cancer. And everybody's in a tragedy mode and emotion and everything. That, unfortunately, is the way we look at cancer. And that's not the truth. A lot of the Western world, the survival rate is close to 90% in many cancers. Right? Okay, so this is where we stand in India. One country, though, has managed to change this, right? The only country in the world where heart disease is not the #1 killer is Japan. UK, heart disease #1 killer. US, heart disease #1 killer. But Japan, heart disease is not the #1 killer because they have adopted the practice of proactive health screening. And that was adopted about 40 years ago, and that has made a telling difference as I will show you. So in Japan, when we look at the population distribution that we have, a majority of the population is from the age group of 45 to 75. That's where the majority is distributed. So a lot of healthy, aging population. Of course, that also then they have to keep them engaged and so on. But already we have Silver Talkies doing that. I'm sure there are more people who are getting into that space. So thank you, Silver Talkies, for doing that. Unfortunately, in India, there are not many people living in that age group. Our age distribution is predominantly from the age of 15 to 45. That's where it is. And you see that graph rapidly declines as you go beyond 60 or 65. Not many people living beyond that age in India. That's the sad state of affairs in India. And we think that is normal. We have accepted that that is normal. That is not the truth. Because when we are born, biologically, we are all the same, right? We have the same 2 eyes, ears, nose, everything. It's our lifestyle that determines how long we are living, the choices that we make. So let's see what the Japanese are doing differently. So how do we prevent diseases? You take out some of the old habits and adopt some new habits, right? So the 7 principles of Japanese or healthy living among the Japanese, right? The first is ikigai. Ikigai is having a purpose in life. You get up, you know that there's a purpose to my life, and you actively take part in that purpose, rather than just getting up, brushing your teeth, having a breakfast, wondering what to do the rest of the day, sleeping, not sleeping, and then going back to bed after your meals, right? You don't want to exist, you want to live a full life. That is ikigai. Of course, hara hachibume is what our elders used to teach us, and that is eating only 80% full. Till your stomach is only 80% full. Nowadays, we don't do that. We love something, we want to eat more. And in fact, in India, affection is shown through food. You go to somebody's house, they will feed you. You refuse, you're a bad guest. They don't feed you, they're a bad host. It works both ways, right? So we love to feed. Even our mothers, they love to feed us. But they'll also say, you're putting on weight. You better exercise. I'm like, mommy? Okay, right. And then there's the famous Japanese tea, the green tea, the matcha tea, as we call it. So full of antioxidants, but seaweed has more antioxidants than matcha tea. So I'm thinking the secret there is seaweed, not so much the green tea. Some other things are more socially common across the world. You ditch the car and walk. The family that eats together stays healthy. Of course, the Hindi movie says eats together, stays together. But yes, if you stay healthy, you stay together, right? So why is that so? When you eat together, you're preparing a balanced diet, a balanced meal, for something for everybody. When you're eating by yourself, you're eating something that you like, which more often than not is something that's probably not healthy for you, and you have no control over the portions because you're not sharing, right? So we eat at meal times together. And of course, Japan has a very strong culture of respecting the elderly. Automatically, if you're older in age, you are supposed to be respected. Whatever the other person's designation, job status, economic status, doesn't matter. If the person is older, they have to be respected. So if you are among the respected, then you really love your life. If your respect is going to deteriorate with age, then you're really not going to enjoy that life. The quality of life is going to come down. The seventh most important principle, which I feel, is the principle of proactive health screening. In Japan, once you join a job, you are supposed to get an annual health screen done, right? You have to do the test and then submit your results to the company. The company doctor will, watch and see if you're improving on the ones that came positive, and they also have to submit it to the government. So this starts from the age of 23 or 24 and goes on till they retire, which is at 60. And then for about 15 years, they are left to themselves whether they want to do it or not. From the age of 75, the government sponsors their annual health screening. So roughly about 60-70% of the population is getting an annual health screening done, okay? So how has this been helping them, right? This is the famous Arashiyama bamboo forest, yes? So if you see the life expectancy, like I said, in India, about 68 years, Japan, 84 years. Highest in the world, so that's 15 years more than us on average. Highest concentration of people over 100, they live in Japan. Breast cancer, India, a lot of awareness, a lot of people talking about it. We are in Breast Cancer Awareness Month, only 67% survival. Across the world and in Japan, it's 90% survival. Let's look at lung cancer. Japan has the highest survival rate in the world. Lung cancer is notoriously fatal. It's at 33%. India, 4%. We have some, lucky people like Yuvraj Singh or Sanjay Dutt, but majority don't survive lung cancer in India because we diagnose it late. We wait for the symptoms to happen, by then it's already too late. Similarly, colon cancer, rectal cancer, stomach cancer, 67% survival in Japan. India is only 9% because in their annual health screening, they do endoscopy. Endoscopy is part of their annual health screening, and that's why the survival rate is so high. So, unfortunately, like I said, in India, health is not valued until sickness comes. Our approach to health is always to wait for the disease to happen and then course correct. Get the damage and then treat ourselves. We never proactively take care of ourselves, which is unfortunate, and we're trying to change that, right? So we all believe in India about nutrition, exercise, self-connect, and also travel, because it helps us know how beautiful the world is, improves the quality of our life. But we never talk about screening. In fact, there is no concrete data on how much screening happens in India, preventive health screening. We don't have scientific evidence. I cannot find a paper which says these many percentage of Indians screen themselves for health. Although WHO is writing one, but I don't know where the data is coming from. But this is where we stand. So let's quickly talk about screening. So what is screening? Normally, like I said, our approach to health is have the disease, get investigations done, go to the doctor, some fantastic doctors, get yourself treated, and then start to feel healthy again. But screening works on the other side. You're asymptomatic, you don't have a problem with your health, you don't have any disease. You actively go get tested, anything that's beginning off, because these diseases notoriously, like heart disease and cancer, take about 3 to 5 years, or sometimes even 10 years to develop. If you find out in the first or second year, you probably could reverse it even without medicine, right? So that's why you screen. And this is where NURA comes in. This is NURA, this is how we look in Bangalore, and we are trying to bring you health screening in a premium service manner, right? We are a collaboration between Fujifilm Healthcare Global and DKH, as Mr. Arun has already informed us. And this was our inauguration by the Japanese Consul General. We opened last World Cancer Day, February 4th is when we started our Bangalore Center. And to start our Delhi Center, which was on July 21st, for the first time, the Fujifilm Global President came to India in their 8-year history. So that's how important this project is for them, because they're first moving from being a manufacturing, product making, to a service industry, right? And also the Japanese ambassador, the Excellency Satoshi Suzuki-san, was there. Why NURA? Why do we, keep tom-tomming about ourselves? First, we are driven and backed by artificial intelligence. We use ultra-low dose radiation. And also, we try to give you the reports immediately, as soon as you're done. I will talk about all of this in just a bit. These are some of the technologies that we use. Ultra-low dose CT scan. the bone scanner, that's the DEXA scan. We also have oral cancer screening, because oral cancer, big problem in India, but not so much in Bangalore. But as we go north, a much bigger problem. Mammogram, I'll talk to you about that as well for breast cancer. And colposcopy, a little higher than a pap smear. Colposcopy increases the sensitivity for cervical cancer screening. Right. So what is the technology that we have? So when we do a traditional CT scan, it is about 50 times that of an X-ray. Like I'm talking about a CT chest. But what is recommended today for lung cancer screening is about 10 times, 2 milligray. At NURA, we go down to 0.2 milligray, which is same as an X-ray dose. Now that's great. We've reduced the radiation. It's like an X-ray. But the downside is the image that comes is what you see on the right side. That's the image. It's noisy. If you do a high-dose CT scan, the one in the middle is what you will get. So we use the artificial intelligence to then clean up the image, and then also use a second artificial intelligence to find out even small lesions that can be missed with the naked eye. This is what our technology does at NURA. And this allows us to use a CT scan safely to get much more information than we will get from an X-ray or an echo or an ultrasound. So that's how NURA is working. And this AI is actually FDA approved and also approved in Japan by the PMDA and also in the European Union by the CE. So all of this, they have approved the AI. So this is a fairly certified AI that we work with. Right, the mammogram. Traditionally, when women want to go for mammogram, they're afraid of the pain, because once they do a mammogram, they never want to do it again. It's so painful. What NURA does is, it reduces the discomfort. Instead of metal plates, we have a fiberglass plate. It touches and then tilts and curves around the breast, so the pressure is evenly divided. So all the women, around 2,000 women that we have screened, are very happy to come back and do the mammogram every year. But that's not where the innovation stops. When you do a traditional mammogram, that's the 2D, that's how the image looks. NURA is 3D tomosynthesized mammogram, so you have a much cleaner, clearer image of the breast, and we can pick up lesions early. When we use a mammogram without AI, and we did this experiment on Japanese doctors, we were able to identify the cancer in 2013, as you see by the blue circle. With the AI, we were able to pick it up in 2011 itself, and look at the size difference. So at that stage, nobody needs to lose a breast. They can just get that removed and be very happy. Yes? And of course, we will serially monitor that. So that's how the AI helps for the mammogram. And this is Seema Kamath. We've taken a permission to talk about her. She's the wife of a billionaire, and she, very healthy before when she came to NURA. I mean, today she's healthy, but we found a lump in the breast. She took treatment, recovered. That's where she's lost the hair, and doing very well, and she's blogged about it. So you can go and look at Seema Kamath's blog. So we can save lives when we do early mammograms, right? So it doesn't matter whether you're fit or not, you still have to get yourself screened. This is about our lung cancer screening. We do a chest X-ray, this is what we see. We do a CT scan, this is what we see. That is why one of the most fatal cancers in the world, we want CT scans done for early screening. And that's what NURA does as well. And if you see breast cancer, maybe the highest incidence, but good survival. Lung cancer, poor survival. Japan, right on top, like I said. India, right at the bottom in survival rate. And this is my favorite test that we do, the heart calcium score. This is what is recommended today for asymptomatic cardiac screening. You're worried about your risk of heart attack, heart calcium score is what is recommended. So real time, you see what is the calcium deposition, and then you can tell. Somebody's symptomatic, then they do an angiogram. Asymptomatic people get this, then we show them the Agatston score, and we also color code it so that people know which artery is affected. So they know the risk that they have and whether they need to see a cardiologist or not. And we have been able to, I mean, of course, we know men have a higher incidence of risk of heart attacks, yes, and also it increases with age. But we have found about 20% positive for heart calcium score for people among the 4,500 that we have screened. Out of these 20%, 400 had critical blocks. And they're all fine now. So we proudly say that we've at least saved 400 lives when we have done the heart calcium score at NURA. And this, drives us to do more and more. We also look at visceral fat and obesity. This is the big killer in today's day and age. All heart disease, cancers, thyroid disease, hormonal problems, everything is related to obesity. We're looking at visceral fat. So when we look at somebody, they may look healthy, but is it subcutaneous or visceral fat makes a big difference, because visceral fat is harmful, subcutaneous fat is not. Right? So that's what we do. So all the red is the visceral fat. Right. So we do blood tests as well, because for some organs and diseases, blood tests are the best. But along with that, we do oral cancer screening, we do CT, we do DEXA, we're doing a diabetic retinopathy now, a vision test, hearing test, everything is getting added, right? We also do stomach health and so on. We're looking at fatty liver as well. Right, so all of this we scan and then use the AI, then we send it to the radiologist, and then it comes to the doctor who will explain to the report to you. All of this happens only in 120 minutes. So that within 2 hours, you get your report, you get a good consultation, you know which part of your body to focus on. And this is how we give a report card. So you don't need to be a doctor to know what your report card is telling you. If you see an A, you know you're in great health. If you see a D, you definitely need to take some action. It need not always mean see a doctor. It could be exercise, diet, lifestyle, something. But you have to take that action if you don't want further damage. And it's a non-fasting test. We don't ask you to fast when you come to NURA. You come at any time of the day, whether you have had breakfast or lunch, it doesn't matter to us. You can come, get your screening done, and we'll still do the test for you. And these are all the tests that we do. And I'm sure the brochure that we have outside will detail all those tests, and you can ask us more questions about it. And of course, right now we are based in Bangalore and Delhi, and we will be in Mumbai by December, for those of you who want to know that. Well, that's all. I was hurrying towards the end, okay? But anyway, all I want you to do is choose health. And I thank Silver Talkies, Saksham, and everyone else for the opportunity and the time. Thank you so much.
Thank you, Dr. Tausif. I'd like to welcome Dr. Tausif and Dr. Amarnath back on stage to answer any questions.
This question is for Dr. Tausif. Thank you very much for those insights on the screening methodology. I did notice on one slide, you had mentioned, and you spoke about it towards the very end, that people can walk in at any time of the day, irrespective of whether you had a meal or not. And I did notice the screening was also for diabetes. So my question to you is, how would you take the readings of diabetes, fasting and postprandial, which we normally do?
Thank you, ma'am, for that wonderful question. What we check is something called as HbA1c.
Okay, that's a random one.
That's what we check. We don't do the fasting and the postprandial, and I'll tell you why. HbA1c will give us an idea of how your sugar control
3 months
has
average.
been. Exactly. Fasting postprandial is very useful for your doctor if they want to prescribe medicines for you, because they can tell you in a day, in a 24-hour cycle, how your body is handling the sugar.
Fluctuations of sugar.
Exactly, the fluctuations, right? But if I want to see how you're handling your sugar for the last 3 or 4 months, then an HbA1c is better. So that's why we're able to do
Thank you.
that.
Thank you so much.
Thank you, ma'am.
I have the question for both the doctors. What's your take on electronic health records? We have been talking about it for a long time. And we get individual reports in paper form, we file it, and we lose track. And nobody knows when a patient comes to an hospital. You need to ask a lot of questions, probably screening and all that. But the aspect of electronic health record, where the privacy is, sort of prevented so that my health record is not, available to some other person. As a policy, what's your take on this?
Thanks for your question, sir. I'll answer it from both angles. From a doctor's perspective, EHRs are something which are really required, especially when I need to, with an elderly person who has about 8 or 9 medicines, about 4 or 5 chronic medical conditions, multiple treatments. So I think that's something which we do require. But one of the fallacies of technology in healthcare is that more often than not, what we see is it's a technology company which prepares an EHR and comes and says, look, I have a solution for you. Can you figure out how to use it in your clinical setting? And when you have 30, 40 patients waiting for you, and the last thing you'd want is look at the computer and keep entering data into that one. So that's our pain point as clinicians. But I think what we will have going forward is, if you've been reading the press, India is coming up with something called as the India Health Stack. And like how you have UPI, which changed the payment landscape in India, you will have something called as the UHI, the Unique Health Identifier. So that will be a repository of all your health records across India going forward. So So I think once that comes in, a lot of pain points, both from a user perspective and a provider perspective, I think that will be streamlined. So hopefully we have the UHIs sooner, and I think that will ensure that EHRs and those kind of things are streamlined better.
Thank you. I have just one more question. Talking about this artificial intelligence-based diagnosis, you showed one screen where it's not there, and the other is able to detect a little more than what normal data would give. How reliable is this, and what is the validation of this data? And what are the factors that go into this artificial intelligence? Is it a fusion of data, or what is the algorithm that is used to arrive at this?
Right. That's a big question. Right. Thank you, sir. And I'll try to answer it to the best of my ability. Please remember I'm a doctor. Yes. Okay. Now, the artificial intelligence that we use, is it reliable? That is why those certifications are there, right? It is FDA certified in the US. It is PMDA certified in Japan, which is a highly ethical country. And the European Union has its C certification, which is also there for the AI. India does not have a certification agency at this point of time. I'm sure it's just a matter of time before that will happen. Maybe Dr. Amarnath knows better about it than me. But that is what tells us that the AI is reliable, number one. Traditionally, when I would do an investigation, let's say a radiological investigation, a CT scan, the port of call is the radiologist, the doctor. The doctor decides what is there and what isn't there. There is no other mechanism for validating that, other than the fact that you can send it to other doctors to get it validated. What we call as an external quality assurance, which is important in today's day and age of NABH, right? Here, what we're doing is we're doing the scan, using the AI to clean up, using another AI to pick up even the smallest of lesions, and then we're showing it to the radiologists. So we've built two more things, one which help us with the safety aspect, and the other one that helps us with the accuracy aspect, and then the radiologist sees it. So I can only hope that that improves the accuracy and the reliability of what we are doing at NURA. That's how I can answer that question. And of course, the technology behind it, yes, we have neural networks and algorithms that's there, but I cannot explain it to you. Being a doctor, I'll have to get my engineer to explain that to you. Thank you.
Good afternoon, doctor. I think we can still call it good afternoon. Thanks, doctor, for both of you for a wonderful and engaging session. I have listened to both of you a number of times, but every time you are talking something new. That's very great of you. Thank you for that. See, my question, I'm Jambunathan, I'm one of the oldest members of Silver Talkies. Okay. See, I have got questions for both of you. Yes. Number one is, Dr. Amarnath, is that, do you have a geriatrics department in all your setups? Or is it concentrated only at your, biggest hospital near the old airport? That is number one. See, regarding Dr. Tausif, my question is that, have you started the nervous also? Nerves, do you study nerves? And that's the entire imaging takes care of any problem with nerves? Because what happens, doctor, when you are talking about older people, one of the biggest problems that we face today is nervous disorder. See, the nerves are not working properly, and there is no proper test for that. And even small nerves, they test something, big nerves, they some. So they call so many things. How, from geriatric angle, how both of you are treating it? That's what, for finding it out and treating it. Thank you, doctor. Once again, thanks for a beautiful session, doctor.
Thank you, sir. So I think to answer your first question about the geriatric department, my entire team moved out of Apollo to Manipal, and then we had the centers in the main hospital at Old Airport Road and in Jayanagar. In due course, we will have, with the acquisition which we've had, it's about 7 or 8 hospitals across Bangalore right now. Difficult to find qualified geriatricians, but we are in the process of ensuring that we have the department in most of the major hospitals across. So it's in the pipeline. I think we'll probably invite you to inaugurate the department as and when we get it.
And to add to that, being an emergency physician, I know, Jambunathan sir, that we have now a geriatric emergency medicine specialty, just emergency medicine for geriatrics. Last 2 years, we are having annual conferences for that. So we're definitely working towards providing good quality geriatric care, even in the emergency department. That's what we're doing. To answer your direct question to me, yes, scanning the brain and the nerves has been our big challenge for NURA. At this point, we're still not, but we are actively working on it. That is our next big development that will happen, and hopefully it will happen in the next 2 to 4 months, where we are going to first start looking for risk of stroke, which is the number one problem that happens in the elderly. And it is also one of the most fatal problems that can happen, right? So we are scanning for stroke now, and we are trying to see if it's best to scan the neck or is it better to scan the head to find a risk of stroke. Because with a CT scan, if I scan the brain, I cannot tell the risk. Maybe an MRI may help, but I cannot put that into my package. Longer time, not yet that well developed, maybe in a year or so. That is one. The second thing that we're focusing on is Alzheimer's. So we are now focusing on Alzheimer's research because there's also path-breaking research where Alzheimer's drugs are coming into the market where we can treat progressive dementia. So that's the other thing that we're working on. And third is migraine. So NURA is working on 3 nerve-related or brain-related issues, and hopefully I can give you the good news in maybe the next 4 to 6 months. If you can bear with us, we'll have that good news also for you.
On that note, let's close this Q&A session.